Dr. K, ICU doc. Number one question I'm getting of late is tell me everything I need to know about peptides. What are they used for? And I'm going to throw down my limited knowledge on my perspective on peptides. What are peptides? They're amino acids, short branch chain amino acids that sometimes are your own body produce. Example, insulin is a peptide as an example. But you're hearing about all these different types of BPC-157, the GLP-1s. And so let me just break it down for you in terms of categories, at least from my perspective. We have the peptides that help from a metabolic health perspective. So the GLP-1s, the Ozempics of the world. There are peptides that help out from a tissue repair perspective. So you're hearing about the BPC-157 as an example. Then there's another branch that you're hearing about in terms of muscle development, precursors to growth hormone that get you fit, okay? So GLP-1, you've seen them on the news in terms of the Ozempics of the world. And what's the advantage of taking a GLP-1? Suppresses your appetite, makes you less cravey, and it's been shown to be an effective way to lose weight and to reverse and improve on your metabolic health. So if you're diabetic, on a couple meds, you're obese, this is a great way to help reverse that. And we've come on the show to talk about how it's important to integrate lifestyle modifications to be able to achieve your goals, because when you're off those GLP-1s, you could regain the weight. There could be some concerns with losing lean muscle. But from my perspective, like if I were 30 pounds overweight, pre-diabetic, would I be interested in taking a GLP-1? Absolutely. But I'm still going to push that weight. I'm still going to eat my protein. I'm going to still do all the right things. So there's that aspect of things. And within that category, there seems to be some anti-inflammatory properties that we're hearing about, like in terms of autoimmune conditions, any conditions related to inflammation. There seems to be a signal that these drugs can help improve these conditions. Is it definitive in the data? As far as I know, no. But this is one of the areas that are emerging. So the one that I get most asked about for sure is around BPC and tissue repair. So this is a branch chain amino acid that you produce in your gut that is shown to enhance healing, especially soft tissue healing, improve blood flow to the area. And so you're hearing about people with, say, meniscal injury, you're hearing shoulder tears, hamstring pulls, all these things that are taking the BPC equivalents and getting great results. The issue with this is this has not been well studied in human beings. We don't have randomized controlled trials showing its efficacy and its safety. So the most of the data that I'm aware of is animal data or case reports. Yes, is it out there? Can you find some version of this? You could go online and find something, but is it regulated? No. Do you know it's safe? No. Do you know if there's any additives or any dodgy material in the when you order it online? No, you don't know that. So my high recommendation at this stage is to wait. Wait till it's Health Canada approved. Wait till it's truly evaluated in human studies. Does it show that there's a lot of great potential here in the two categories I'm talking about? Absolutely. Do I think it's the future? Absolutely. But we need time to evaluate to make sure that this is as safe and effective as we hope it is. Third area, I must say I know less about it in terms of peptides for muscle enhancement, precursors or essentially analogs to growth hormone. I'm not totally aware of what's out there from that perspective, but I do get asked about it. And similar to the BPC-157, this has not been well studied. It's not been shown to be, not to have any randomized control trials or long-term studies in humans. So it's a waiting game, guys. My prediction, in my humble opinion, that this is going to be very promising. This is going to be something that from an anti-inflammatory, from a healing perspective, this is something that I want, like, honestly, if there's an opportunity with our group to evaluate this, I would be all over it. Love to see in terms of tissue repair and improvement on critically ill patients. That'd be so exciting. I mean, I only have so much bandwidth, so I know my research team, if they're listening to this, I'm not saying we're doing this right away, but if we have the opportunity, if the opportunity comes on our plate, we got to dance. I'm hoping with the amount of scientists and the interest level within the nation that we do get ahead of this and really evaluate this in a thorough manner so we could confidently say in one direction or another that this is something that we should be looking into, but we need time, guys. So moral of the story is promising emerging data in terms of peptides, but we need time. We need to evaluate this. And for me, because of how popular and how the level of interest, I think as a nation, we should prioritize this in terms of the evaluations. We can confidently give opinions on how we should approach this, because the people will speak. If people are saying they want they want to try this, it's on us to evaluate it and get a sense of what that efficacy and safety is. The people have spoken. Let's answer their questions as opposed to sitting on the sidelines and hoping for the best.